My friend, our heart is a miracle. It works without rest, beat after beat, breath after breath, from the moment we are born until our hair turns gray and our hands begin to tremble. And because it is so quiet, so devoted, we often forget that the heart can get tired too, that it also needs to be heard. In more than 30 years of practice, I've met many patients in their 60, 70, even 80-year-old, and they often tell me, James, I don't have any serious symptoms. I'm just a little tired. But sometimes that little tired feeling is the very first whisper of the heart before a heart attack draws near. What makes a heart attack so dangerous is not just how fast it strikes, but the fact that it sends warning signs early and we tend to ignore them. A slight discomfort in the chest, slightly shorter breaths than usual, feeling winded after climbing the stairs. These signs are so small that many people chalk them up to just getting older. I always tell my patients, the heart never suddenly betrays you. It always tries to send signals. The question is whether you notice them or not. Today's video will help you understand 7 early warning signs, the ones most easily overlooked, yet most important for protecting your heart. And I hope that after watching, you'll listen to your body with more gentleness, more patience, and more care. Signal number 1, chest pressure or discomfort, not always dramatic pain. My friend, when people think of a heart attack, most imagine a crushing chest pain, like someone squeezing the heart with a fist. But in reality, many of my patients experience something very different. Subtle quiet, so mild they assume it's just indigestion, gas, or a pulled muscle. I remember Harold, 72, a gentleman who always wore a warm smile. He told me that before his first heart attack, he only felt a heaviness in the center of his chest, as if someone had laid a heavy book on top of it. No sharp stabbing pain, no intense cramping, just an uncomfortable pressure he assumed would go away on its own. But his body was trying to tell him something far more serious. Chest discomfort is a sign that the heart is not getting enough oxygen and blood. It's the first alarm bell, soft but serious. This discomfort can spread to the left shoulder, move up into the neck, radiate into the arm. It may come with slightly shorter breaths, a vague sense of unease or restlessness that you can't quite explain. And many people, especially older adults, brush it off. Harold told me something I will never forget, James. If I had understood that my body was begging for help, things might have been very different. My friend, the heart doesn't scream, it whispers. And chest pressure, no matter how mild, may be one of the most important whispers of your life. Signal number 2, pain spreading to the neck, jaw, shoulder, or arm, especially the left side. My friend, there's something many people don't realize. Heart pain rarely stays in just one place. It may start in the chest, but very quickly it can travel as if your body is desperately trying to get your attention. I once treated a patient named Raymond, 72. He told me that the night before his heart attack, he felt a dull ache that started in his chest, then crept up into his neck, and finally into his jaw. He assumed it was a toothache and went to bed early. The next morning, he was rushed to the hospital in critical condition. He later told me, James, if only I had known that pain was my heart crying out for help. Those words still weigh on me to this day. My friend, when the heart is deprived of blood, it sends out pain signals, but our nervous system isn't always good at pinpointing exactly where that pain comes from. So the discomfort can spread to the neck, the shoulders, the arm, especially the left arm, the upper back, and even the jaw. The pain doesn't always feel dramatic. Sometimes it's just a heavy feeling, a dull ache, a strange tightness or pulling sensation. Some patients describe it as like someone put an ice-cold stone on my arm, or like an invisible rope wrapped around my shoulder. The danger is that many people mistake this for muscle strain, pinched nerves, simple fatigue. But the heart doesn't send false signals. It just doesn't know how to speak in words, so it uses pain to get your attention. I want you to ask yourself, have I recently felt pain that started in my chest and moved to my neck, jaw, or arm for no clear reason? If the answer is yes, even once, that's not something to ignore. In medicine, there's a saying I deeply believe in, better to be safe than sorry. Because a heart attack doesn't always give us many second chances. My friend, if your body sends you a signal, trust that it's doing so to protect you. Don't dismiss radiating pain. Sometimes it's the last fragile voice of a heart asking you to save it. Signal number 3, unusual fatigue. when your body is quietly warning you. My friend, there is one signal that many people downplay, even ignore for months: a strange, unexplained fatigue. The kind of tiredness that doesn't feel like your usual. I worked too hard or I slept too little. It's a deep, energy-draining exhaustion that shows up even on quiet days. I remember Margaret, 72-year-old. She spoke to me with confusion in her voice. James, I only walked from the house to the yard, and it felt like I'd climbed a hill. She had no crushing chest pain, no dramatic shortness of breath, just a sense that her body was running on empty. Like many others, she simply assumed she was just getting older. But after a deeper examination, we found that her heart was already functioning poorly due to reduced blood flow, an early sign of heart disease, and a potential precursor to a heart attack. My friend, imagine your heart as a pump that has worked faithfully for decades. When a blood vessel starts to narrow, even partially, the heart has to work harder to push blood through. That strange, unusual fatigue is your body saying, the energy is not being delivered the way it used to. Some people feel mild shortness of breath after just a few steps, muscles that feel weak or unresponsive, waking up in the morning feeling like they never rested at all. If you've ever felt this way, I urge you, don't rush to blame it on age, because unusual fatigue, especially in people over 60, can be a subtle sign that the heart is struggling. After she recovered, Margaret told me, I wish I had listened to my body sooner, and that's what I want to pass on to you today. Let every unusual sensation be the start of curiosity and care, not dismissal, because sometimes that quiet, lingering fatigue is the very first cry for help from your heart. Signal number 4, spreading pain, when discomfort doesn't stay in one place. My friend, one of the most silent yet frightening warning signs of a heart attack is migrating pain. Not sudden crushing chest pain, like in the movies. Sometimes it's just a mild ache, but it moves. And that movement is your heart's way of waving a red flag. I remember one of my patients, Harris, 72. He told me that on the day before his heart attack, he didn't feel any classic chest pain at all. Instead, he felt a light nagging pain that started in his chest, ran into his shoulder, down his left arm, and even up into his jaw. He assumed it was just muscle soreness from sleeping in a bad position. He said to me, James, I never imagined my heart could cause pain all the way up in my jaw. But it can. When the heart doesn't get enough blood, it sends out distress signals, and our nervous system sometimes misplaces where that pain feels like it's coming from. That's why discomfort can spread to the left shoulder, the left arm, the back, the neck, the jaw, even the upper part of the stomach. I often tell my patients, if your heart is the conductor of your body, then your nerves are the lines carrying its messages. When the conductor is in trouble, the entire orchestra feels it. When the conductor of an orchestra falters, the sound becomes chaotic, and that chaos can show up in any instrument. Radiating pain works the same way: a misplaced signal, yet an incredibly important one. Harris was fortunate. He reached the hospital just in time. When the doctors examined him, he was already in the early stages of a heart attack. Had he ignored the symptoms for just a few more hours, the outcome might have been very different. My friend, let me say this slowly and clearly, the way I would say it to someone I care deeply about. Radiating pain is not a small issue. It is the heart crying for help. And if you ever feel discomfort that moves from the chest to the shoulder, the jaw, or the back, seek help immediately. Your heart deserves attention sooner rather than later. Signal number 5, a sense of anxiety, restlessness, or a bad feeling with no clear reason. My friend, there is something I have learned in more than 3 decades as a cardiologist. The body always speaks before the heart gets into real trouble. The problem is, sometimes the voice is so soft that unless you're truly listening, you miss it. Let me share the story of Richard, 72. One afternoon, he called me and said, James, I'm not having chest pain. I'm not short of breath, but I feel this strange uneasiness, like something inside me just isn't right. I asked him what he was worried about. He shook his head. Nothing. It just feels like my heart is whispering a warning. And he was right. A few hours later, he was admitted to the hospital with a mild heart attack. Had he ignored that feeling, the story might have ended differently. I share this not to frighten you, but so you'll understand. An unexplained sense of anxiety can be the body's final survival signal, the heart sending its last whisper before a storm. Some people describe A fluttering or irregular heartbeat, even if it's not fast. Feeling restless or unable to sit still. A strange inner pressure that creates fear. Or simply an intuition that something is wrong. Science calls this a neurohormonal response to reduce blood flow in the heart. But I prefer to call it the body's intuition, the wisdom that kept humans alive long before modern medicine existed. My friend, if one day you feel an unusual anxiety, a heaviness you can't explain, especially if it comes with fatigue, mild nausea, blood pressure changes, or slight chest discomfort, please don't ignore it. Let a doctor check. One checkup can save a lifetime. Remember, the heart doesn't always shout. Sometimes a whisper is all you get. Signal number 6. Persistent uneasiness, or a deep sense that something isn't right. My friend, when people think about heart attacks, they imagine obvious symptoms, chest pain, shortness of breath. But one of the quietest and most easily overlooked signs is this: a persistent, vague sense of unease, a feeling that your body is not normal. Have you ever felt this? Not actual pain, not breathlessness, but a heaviness inside, a strange tension, an internal alarm with no clear cause. I remember Raymond, 72. He told me that about a month before his heart attack, he often woke up at 3 a.m. with what he called a wave of anxiety washing over him. No chest pain, no trouble breathing, just an unshakable feeling that something wasn't right. He said, "James, I kept sensing something bad was coming, but I didn't know what to worry about." Many of my patients have described the same feeling, and science supports this. When the heart begins to lack blood, the nervous system reacts, creating subtle signals like restlessness, anxiety, light palpitations, trouble sleeping, uneasiness without a cause. My friend, not every feeling of anxiety is a heart warning, but if you're over 60, have conditions like high blood pressure, diabetes, or high cholesterol, and suddenly experience unexplained persistent uneasiness, that is something you should not ignore. Your body has its own intelligence. It knows when danger is approaching. The only question is whether you'll listen. Trust your instincts. Check early. Sometimes that vague intuition can save your life. Signal number 7. A sudden sense of danger, unusual fear, or a feeling that something inside is wrong. My friend, one of the most overlooked, yet one of the strongest warning signs of a heart attack is this: a sudden, inexplicable feeling that something is wrong with your body. I remember Bradley, 67. One morning he told his wife, "I don't know why, but I feel scared and heavy inside, like something bad is about to happen." He had no chest pain, no shortness of breath, no nausea, just a vague, unsettling fear. His wife insisted he go to the hospital, and it saved his life. The ECG showed he was in the early stages of a heart attack, only hours away from a major event. I often tell my patients, your body is always talking to you. The question is whether you're willing to listen. When the heart is deprived of blood, the autonomic nervous system reacts strongly, creating restlessness, anxiety, a sense of impending danger, uneasy fear that makes no sense. Some describe it as, "I'm afraid, but I don't know what I'm afraid of." One of my patients, at least 69, told me that on the night of her heart attack, she didn't feel chest pain at all, just a sudden, overwhelming fear that made her sit up and call her son. That decision saved her life. This is why I want to remind you, if your body tells you something is wrong, believe it. Not every warning comes as sharp pain. Sometimes the strongest warning is a gentle, strange feeling, like a soft knock on the door of your soul saying, "Pay attention to me." Check. Protect yourself. My friend, listen to your body the way you listen to an old companion. It has been with you your entire life, and it always tries to speak before danger arrives. A gentle closing message. My friend, your heart has been your companion since the moment you entered this world, beating faithfully through every chapter of your life. Yet sometimes we forget about it until it sends a desperate signal, hoping we'll finally pay attention. The 7 warning signs of a heart attack I've shared today are not meant to frighten you. They are meant to prepare you, to help you recognize danger early so no one has to lose precious moments of life unnecessarily. You deserve to live healthy, fully, peacefully, and that begins with listening to your body every day. Remember this: a heart attack never comes out of nowhere. It always sends signals first. If you notice any of these signs, please don't hesitate. Give your heart a chance and give yourself more time, more memories, more life. If today's message brought you clarity, comfort, or simply reminded you to care for yourself, I invite you to subscribe to Heal Fit Health. Let's continue this journey together, honoring your health, strengthening your hope, and walking through the later years of life with resilience, grace, and peace. Hit subscribe, turn on the notification bell, and let every new video be a gentle reminder that you still have so many beautiful days ahead.